This is a very common question asked by many of my patients visiting my consultation room. So what are these sex pills? So let me give you a brief picture about these sex pills. Myself, Dr. Pramod Krishnappa, consultant uro-andrologist. Sex pills are basically referred to the PDE5 inhibitors, which are sildenafil, tadalafil and avanafil. Most of you are aware that the Viagra basically contains a sildenafil. Viagra is a commercial name and what it contains is the sildenafil. So the Viagra was first launched around 1998-1999 and since then it is being used very commonly by the andrologist to treat the erectile dysfunction. So sildenafil, tadalafil, avanafil, all these PDE5 inhibitors are safe. We do assess the patient's condition, his cardiac status and his stress status, which means how long can he walk or how long can he run or how far can he climb the stairs. So if somebody can walk around 2 miles in around a half an hour or so, or if he can climb the stairs, 2 flights of stairs without chest pain, then he is fit to have sex and also fit to receive these sex pills. So we do not need an echo scan or the heart scan to prescribe these medications. So sildenafil is usually taken as an on-demand medication, which means you take it just before the sex. Usually we advise take it 1 hour before the sex. And so again, since sildenafil has interaction with the food, we need to give few specific instructions. So what I commonly advise is take the sildenafil tablet at around 7:30 in the evening, have dinner at around 9 o'clock, and then you will have the next 4 to 5 hours to have a sexual intercourse. If somebody is taking tadalafil tablet, so he has to, suppose if he is taking as an on-demand medication, which means only just before the sex, he has to take it at least 2 hours before the sex. Taking a tablet and immediately attempting an intercourse may not be successful because the tablets needs time for it to act and induce an erection. And tadalafil has no interaction with the food, only that it has to be taken 2 hours before the sex. Sometimes we do prescribe tadalafil on a daily basis. In such scenarios, the 2 hours time need not be followed. You can just fix a time in a particular day. For example, just take it after the dinner. So that is still okay. And avanafil also has no interaction with the food. So again, it can be taken either before or after food, it doesn't matter. But again, it has to be taken at least half an hour or 1 hour before the sex. Usually, so sildenafil and the avanafil are usually prescribed as an on-demand medication, which means take it only before the sex. Whereas tadalafil can be prescribed as an on-demand or as a daily pill. And tadalafil has other benefits. For example, if an elderly man also has a urinary problem, so tadalafil does help in relieving the symptoms of this urinary system as well. So you should ideally consult a doctor before taking these medicines because some of the aspects needs to be examined, and if somebody is taking any heart medications, we need to check and verify whether these medications, sex pills, are safer in such patients or not. So please do not order it online and take it randomly on your own. Consult a uro-andrologist for better and a specific advice.